Hello, welcome to the Chris Davis Show. I'm your host, Chris Davis, and today we're going to talk about the GOP's healthcare bill failure. This past Monday, Senate Majority Leader Mitch McConnell wanted to put a revised healthcare bill on the Senate floor. This revised healthcare bill is called the Better Care Reconciliation Act. It's revised from the American Health Care Act. Other than the name change, the biggest difference with this bill was that it was still going to leave taxes on high-income U.S. citizens. It still holds everything that the previous bill had. Tax penalties for not having health insurance would be gone. Employers would no longer have to provide health coverage if they had more than 50 full-time employees. It plans to reduce Medicaid, reduce payments to Planned Parenthood, allow states to waiver out of covering the 10 essential health care benefits. People with pre-existing conditions wind up paying more. So it still has all the other problems that the previous bill had. But Mitch McConnell was going to put this on the Senate floor. He already had two senators who said they were going to oppose this bill. It was Rand Paul from Kentucky and Susan Collins from Maine. So Mitch McConnell couldn't afford to lose really anyone else to get this bill passed. He needed 50 senators in order to pass the bill. But late Monday night, two senators came together saying that they were not going to support the Better Care Reconciliation Act. They're Mike Lee from Utah and Jerry Moran of Kansas. CNN explains the story.
Is essentially the worst case scenario for Senate Majority Leader Mitch McConnell. Two more Republican senators, Mike Lee of Utah and Jerry Moran of Kansas, have announced that they will not support the latest version of health care reform. It effectively means this bill is dead. This is what Senator Lee said in his statement last night. Quote, after conferring with trusted experts regarding the latest version of the Consumer Freedom Amendment, I've decided I cannot support the current version of the Better Care Reconciliation Act. In addition to not repealing all the Obamacare taxes, it doesn't go far enough in lowering premiums for middle-class families, nor does it create enough free space from the most costly Obamacare regulations. And Jerry Moran's statement went even further. He said that the Senate needs to start fresh and open up the legislative process. He also said that he would not put his stamp of approval on bad policy. Now, Senate Majority Leader Mitch McConnell was already in a difficult position. He needed to hold on to all 50 votes. They had hoped that as early as today they'd be voting on the motion to proceed to bring the bill to the floor, and it looks as though, at least for now, the Senate version of health care reform has been put on indefinite hold.
The CBO says if this bill got passed by 2026, the number of people uninsured would increase to 22 million. And by that year, 2026, 49 million people would be uninsured. Due to the failure of the Better Care Reconciliation Act, Senator Mitch McConnell is not giving up. He plans to go with a repeal only of Obamacare and a 2-year delay. The CBO said that a health care plan like that would cause 17 million people to be uninsured next year, and by the year 2026, 32 million people would be uninsured. There are 3 senators who have come out to say that they are against repeal only. Susan Collins from Maine. Let me read out the other two. So we got Susan Collins from Maine. We got Shelley Moore from West Virginia and Lisa Murkowski from Alaska. This effectively kills the bill from getting passed. CNN explains that story. Please listen.
Tonight, Senate Republicans are running out of options. Yet another attempt to address health care reform has run into a major roadblock.
I regret that the effort to repeal and immediately replace the failures of Obamacare will not be successful. That doesn't mean we should give up.
Soon after Senate Majority Leader Mitch McConnell made his pitch to repeal Obamacare without a replacement, 3 senators, Susan Collins of Maine, Shelley Moore Capito of West Virginia, and Lisa Murkowski of Alaska, said they would not support a vote to bring the new version of the bill to the floor, essentially killing the measure. Despite losing those 3 senators, McConnell said he would plow ahead with a vote, even if it will fail.
Well, I think we'll have to see what happens. We will have demonstrated that Republicans by themselves are not prepared at this particular point to do a replacement. And that doesn't mean that problems all go away.
The failure by Senate leadership and the way McConnell handled the situation has one prominent Republican upset. Wisconsin's Ron Johnson was angry over reports that McConnell was telling moderate senators not to worry about long-term Medicaid cuts. McConnell said his remarks were misinterpreted. But when asked if he still has faith in McConnell as a leader, Johnson responded, quote, "I found those comments very troubling." When a reporter followed up, asking, "So you're not going to say yes to that?" he repeated, "I was troubled with those comments." But despite the crack in McConnell's grip on control of the caucus, most Republicans remain behind him. Do you still have faith in Leader McConnell?
This is not about Mitch, it's about the politics of health care.
The path forward for Republicans right now is unclear. The problems that existed between the conservative and moderate wings of the party remain, leaving senators in search of an alternative that doesn't currently exist, as Democrats open the door to a bipartisan conversation.
It's time to move on. It's time to start over. Rather than repeating the same failed partisan process yet again, Republicans should work with Democrats.
Okay, Donald Trump has responded to the failure of the GOP to pass the health care bill, and he threatens senators who keep opposing the health care bill. The Washington Post has the story. Let's listen.
It's not an option. And frankly, I don't think we should leave town unless we have a health insurance plan, unless we can give our people great health care, because we're close. We're very close. The other night I was very surprised when I heard a couple of my friends, they really were and are. They might not be very much longer, but that's okay. I think I have to get them back. That's right. Well, no, you didn't go out there. This was the one we were worried about. You weren't there, but you're gonna be. Look, he wants to remain a senator, doesn't he? Okay. And I think the people of your state, which I know very well, I think they're going to appreciate what you hopefully will do. Any senator who votes against starting debate is really telling America that you're fine with Obamacare. But being fine with Obamacare isn't an option for another reason, because it's gone. It's failed. Not going to be around. We pay hundreds of millions of dollars a month in subsidy that the courts don't even want us to pay. And when those payments stop, it stops immediately. It doesn't take 2 years, 3 years, 1 year. It stops immediately. On the other hand, and I have to say this, a yes vote will let senators debate the future of health care and suggest different ways to improve the bill. And we're going to do that today. That's what we're going to do at lunch. We are so close.
Okay, the GOP cannot pass the bill, cannot pass the health care bill in a partisan way. Let me give you my thoughts on why. To me, they can't pass the bill in a partisan way because their party's divided. Maybe because of Trump, and maybe because of all the town hall meetings and the protest, but their party is divided. If their health care bill cuts too many benefits, moderate conservatives won't support it. If it's too generous, the Tea Party won't support it. So the party is divided. They could work in a bipartisan way to get their health care bill passed. They could work with Democrats to tweak the Affordable Care Act and make it better to lower the premiums. They could pass single payer, but I don't think it's going to be useful or effective for Donald Trump to threaten politicians' Senate seats if they don't support his bill. If they do support his bill, most likely they're going to lose their Senate seat because no one wants to repeal the Affordable Care Act with a plan that makes them pay more for less. So those are my thoughts on it. Let me know your thoughts in the comment section below. That's all we have for today. If you like this video and you found it informative, please like and subscribe and have a great day.